Welcome to my channel, Sunshine Shoulders. I'm Calvin. Thank y'all so much for stopping by again today. I got a special guest, Mr. Michael Onstad here, our resident health insurance expert. What's going on, Mike?
Well, very busy. It's a strange industry. The selling of the policy is the easy part. Let me tell you, it's making it work and function. That's the challenge.
Now I know people have met you on my live stream, but this is a little bit more informal, and you can kind of relax because you were on a live stream before. How long have you been helping expats over here in the Philippines with their health insurance?
4 years now.
4 years. Are you surprised that not more expats have health insurance?
Well, a lot of them self-insure, which, of course, some can. If you've got a couple of million pesos that you can lose, you should be fine in most cases. And then they have Medicare. They can fly home to that if it really gets bad. Yeah.
Yeah. I just want to kind of let people know that you're just like the rest of us. You're not some special guy that they beamed here from another planet. Where are you from in the States?
I'm from Vancouver, Canada.
Oh, you're from Canada. Wow.
Yeah, yeah.
I learned
51st state.
something new. I learned something new today because I didn't know that prostitution was quote unquote kind of legal over there, legal or limited legal over there. Did you know
What
anything
is
about that, Mike?
about what is legal?
Prostitution to a certain extent in Canada.
I don't know about prostitution, but I know ganja is.
Yeah, I was reading about that today. I believe that as long as the woman is in a brothel, she it's legal, but they can't sell it on the street. And then if they catch
Yeah.
you, they're gonna let her go, but they're gonna lock the John up. But anyway,
Well,
welcome to the channel.
Maybe I left Canada too early then.
Now, are you married or single?
I've been married for 7.5 years, and I have a 6.5-year-old daughter.
Now, are you one of those guys who got off the plane and just ran up to the Filipina and introduced yourself? Or did you meet
No,
her on the dating site too?
we chatted for 5 years before I came here.
Yeah, so you met her on the dating site.
No, no, I stay away from dating sites. I had enough of that with the Russian bride fiasco. So I decided I'm just going to look around on Facebook and I'm going to find them, you know, just on Facebook. And I found this lady that was in the company of nuns. And I figured, how can I go wrong with that one?
Oh, okay. But I mean, you met her online. You didn't see a lot of people are telling, especially a lot of my audience, that 65 and 70-year-old men don't have to meet these young ladies online. Just come over here and introduce yourself. And I'm like, don't do that, guys. Okay, you're gonna get embarrassed. You're probably gonna
Yeah.
get your feelings hurt.
Yeah. Well, I don't have a lot of advice to offer there. I think it's a matter of good luck.
Yeah, well, good. Okay, now I named the video "Matter of Life and Death" because I'm pretty sure you've got some probably good stories and sad stories. You want to start out with the sad ones or the good ones on, you know, what having a good health insurance policy can do for you, or the consequences of going without health insurance over here. It's up to you, Mike.
Okay. Well, let me tell you a little story that shocked me. I woke up one morning and someone had sent me a picture of a dead body in a hospital. And it turns out it was the widow. And she said, they won't release my husband's body until I pay the hospital bill. What should I do? I said, well, Unfortunately, your husband did not buy the health insurance, so there's not a lot I can do. But you might want to set up a GoFundMe, and, something like that. And I sent her a few thousand pesos to help out. But truth be known, she was the one that talked him out of getting the health insurance. How do you like that?
Oh, wow.
Yeah, they're not big believers in it here, as a general
That's,
rule.
yeah, that's kind of shocking because they've got universal health care here, right?
Yeah, but not expats.
Yeah, I know not expats. I mean, she talked him out of it. I guess she wanted the extra money in the house or something. I don't know.
Yeah. Well, yeah, Phil Health wasn't going to pay his hospital bill.
Yeah,
Yeah.
absolutely. I'm saying she talked him out of getting the health insurance
Yes,
because I
that's right.
guess she wanted the extra money to stay in the house.
Yeah.
Um, but that should be a personal decision. I was an insurance agent. Well, I still am. It's 20 years now, over 20 years, 22 years. And I know that's a decision we have to make on our own. How long have you been in the industry, Mike?
45 years.
45 years. Wow. Well, hell, you don't look that much older than 45. How old are you, Mike, if you don't mind us asking?
I'm 66,
Also, you started, yeah, you started young.
21 years old.
Now, have you done anything else besides sell insurance?
No, no,
That's
that's
it.
it. Yeah.
I do want to congratulate you, man, because you won a lot of awards over here in the Philippines, selling and helping, basically helping expats.
Yeah. No, I got a room designated as a storage room for my trophies.
Wow. Let me ask you something. What if somebody was living in Thailand or Vietnam or any of these other Southeast Asian countries? Could you help them?
As long as they don't mind coming here to apply, but I'm restricted by law to only sell health insurance in the Philippines. But I can sell it to someone here if they're here for a couple of weeks, put it in force, and then I can design it to cover them full time in whatever country they'd like.
Now that's great, man. I hope anybody out there that's listening, because I know that it's not really that expensive here. Now let me stop right there and say that your health is what purchases your health insurance. Okay. But all things being equal, what would a 60-year-old man in good health, not on any medications, what would his policy be for that? I think that million peso policy that you said, that's like the
Well,
basic policy.
the ward plan, which is the million, is bare bones. I generally recommend the private because they shuffle you into private whether you like it or not, and you'll have to pay the difference if you have the ward plan. Uh, but the premium for the private would be about 80,000 pesos a year for a 5 million
Wow,
benefit limit.
my God. That's
And for the
crazy,
ward,
man. That's a great
and
rate.
the
I,
ward,
I, I think people think it's more expensive. Maybe
uh,
that's why they don't get it.
yeah, well, you got to ask the questions, and I'm quite happy to answer them. So, yeah, but the ward plan might be 35,000 pesos for a million.
Hmm.
Yeah,
Now I know you just got back off like a tour that you do. You do meet and greets, right?
yeah. No,
Because I,
I go to all the expat centers throughout the Philippines once a year at least. Yeah. I was just down to
yeah,
Iloilo and Bacolod.
I saw you on that Philippines live. I think y'all did a live stream.
Yeah.
I saw you on there. Yeah, I remember him, man, when he was married to his wife, his Canadian wife, and they came to my meet and greet in Iloilo. But he
Oh,
wasn't the big superstar that he is now. I don't even
Yeah.
think he probably would. He wouldn't even know me now. Probably he's so big. But yeah, I
Yeah.
saw you on there. And do you have any upcoming meet and greets?
Well, next on my list is Cagayan de Oro,
Yeah,
CDO.
have you ever
But
been there before?
I'm gonna take I'm gonna take a couple of months to rest. It takes it out of you traveling in this country or traveling, period. I mean, it used to
Well,
be fun.
give us a good story, Mike, about somebody that went ahead and got the life insurance. I mean the health insurance. I don't know why I keep talking about life insurance. You don't offer life insurance, do you?
No, I mean I can provide it, but the mortality tables in the Philippines, I mean they wreck the rate. You're
Mm.
better off buying it somewhere in the States, making sure it covers you here, and you'll save about
Mhm.
25%.
Now, you allowed to say what company you represent here?
Well, my main carrier is Pacific Cross. When I first
Okay.
started, I had three, and then I realized you can't just sell a policy and walk away because the service here just doesn't work for us. It's not acceptable, and I had to pick one that checked most of the boxes, and then integrate with it, get to know the management, become important enough to them that they'd listen to me, and that's what I've done. So I can get
Yeah.
things done. I can get claims processed quickly. Yeah.
What's the average turnaround on a claim?
Well, if it's not a emergency hospitalization, which is 99% of the time is settled directly, which means there's no turnaround time. And, and believe me, that takes a lot of organization to make that work, but we manage. If it's a reimbursement claim, we're down to 30 days.
Mm, that's damn good over here in the
Yeah.
Philippines.
Oh, it's unheard of.
Yeah, that's unheard of over here.
Yeah.
Now, does it cover doctor visits, the private plan for 80,000 pesos per year?
Uh, I mean, you can add the outpatient, but I don't recommend it because seeing a doctor is 1,000 pesos, if that.
Yeah, I was just asking.
There is an annual medical exam that's included in it, but to add the outpatient benefit, it's really not worth it. So I leave
Yeah,
that out. That's where self-insurance comes in.
yeah, that makes a lot of sense. Well, give us a good story because I know you're busy, man. You just got back. I know you want to
Yeah.
relax, but I wanted to get you on here because it is a matter of life and death, and having health insurance is very important. But give us a good story, Mike, before you get off here.
Well, there was one recently, and it was somebody that was just in the throes of applying, but about 4 days after submitting the application, so she's not covered. She had a heart attack. And so she ended up in the hospital, no coverage, and they wouldn't let her out. So she took out her IV and made a dash in her hospital PJs with her ass hanging out.
Wow.
You got to picture that. No, well, they try to hold you, uh, but she wasn't going to have it. So anyway, she's trying to raise 1,000,000 pesos to pay for her heart attack, and we'll see how that goes. But it's too bad she didn't apply a month before. Anyhow,
Yeah.
that was a funny one. Huh?
My son's mother, she had a story sort of like that. When she had her son, she didn't have the money to pay the hospital. So she jumped out of a second story building,
I, I
the
I've heard
second
stories
story
like that.
window, and took out running, and they haven't called her since. She's in America now.
Yeah, well, sometimes they'll stop you from leaving. They'll they'll contact immigration and prevent you from leaving.
Do you think it's a good idea for a man over here to make sure that his Filipino girlfriend is covered too?
Yeah, because he's going to end up paying the bill whether he likes it or not. Yeah, no, I have a most guys cover their Filipina, their asawang as they call them. Yeah,
Yeah, because we buy them
definitely.
everything else but life insurance and health insurance. I've seen
Yeah,
guys buy those fancy cell phones and it costs more than the house she grew up in.
yeah,
But they don't understand that you're not only are you responsible for her, I mean for yourself, you're responsible for her.
yeah. And then we can talk about the family. Depends on the
Yeah,
circumstances.
but do you have a good story to tell us though? Somebody that made the right decision and took a policy with you, got sick and was covered with very little money out of their pocket.
I've got quite a few of those, but they're boring stories because they work out. It the good stories are the ones that don't work out. And I've already mentioned the only one I can think of, and the one you're talking about. I heard about that, and that's why you'll find that the private rooms are always on the second floor or higher because they don't
Yeah.
want you jumping out the window.
Yeah, she unhooked the IV herself,
Yeah,
and that would have been, let's see, maybe 2006 or something like that. It's before I met her. It was before I met her, but yeah, she jumped out the window. But
yeah,
I had a story like that. My son was born premature in Zamboanga City, Show Hospital, and he was in the hospital 18 days, 16 in the incubator, a World War II incubator, by the way. And his
yeah,
mother was in the hospital for 7 days. Well, my bill was 350,000, and they wouldn't unhook him or anything until I paid that bill.
yeah,
That was 2012.
yeah.
Yeah,
Oh, there is a law. There's a law there that say they can't hold you, but laws in the Philippines, they're enforced at their discretion.
yeah, I
And
heard that.
apparently, if you're in a private room, it, it's you're exempted from that obligation to release you. And that's another reason why when you're an expat, um, you have a hard time getting them to put you in a room other than a private.
Now I'm gonna put Mike's information in my comment section. I'm gonna pin it up there. I always pin your comments in all my videos because I think it's important. See, I'm retired, Mike. I mean, I've still got my license. That's the only way I can continue to collect my renewals, but I'm retired. And people always ask me, what type of health insurance can I get? And I always just send them towards your way. And that's the reason I do it. But I'm going to put your information in there, man. Thank you for your time. Is there anything else you want to say to the viewers?
Well, if you haven't been here very long, you may not be aware of how things operate here. And, I don't want to sound derogatory, but everything moves slowly here, including hospitals. This is why it's important that you deal with someone that's going to micromanage the whole process. I have a registered nurse on staff, speaks the local languages, and that is absolutely instrumental. She knows what buttons to push at the hospital to get all the documents in place so you don't have to pay to leave. It's all paid directly.
Wow. Let me ask you this. Okay, so you take out the policy, it's approved. Now, how long before you're covered?
You're covered for accidents immediately. Everything else, 30 days. with the exception of pre-existing conditions, which will have a 12-month waiting period specific to the condition. And after 12 months, you will have to pay a premium loading, in other words, extra premium, to cover the pre-existing condition at your option. And on occasion, uh, pre-existing conditions, if they're serious, will be permanently excluded.
Well, thank you so much. I really appreciate your time, man. You're really helping a lot of people because every time I look on your Facebook, you getting another award. Now, do they get jealous of you? Do they think you got an unfair advantage?
I don't know about that, but apparently I do annoy a few. So, so I got to lay low.
Yeah, well, thank y'all so much for stopping by. Finding your heart to help somebody. Now, the day goes by and I don't help somebody because I don't know. If I don't know anything else, I know this one thing for sure, Mike. We help other people, we help ourselves. Take care. Stay safe, stay out of trouble. I'll see you next time. Don't do anything stupid. If you can afford to self-insure, then do that. But most of us can't self-insure, Mike. Give Mike a call. Let him give you a quote. You'll be shocked at how affordable a good policy is and the peace of mind that it gives you. Take care, everybody.
Wow.